Chronic lymphocytic leukemia is a slowly evolving cancer that affects a type of blood cells called B lymphocytes. The diagnosis of chronic lymphocytic leukemia often comes as a big surprise for patients, as most of them have never experienced any symptoms. People living with chronic lymphocytic leukemia feel uncertain about their future, since the course of the disease varies widely and is quite unpredictable. Upon diagnosis, your physician will assess your disease and check for signs that may indicate that you need treatment. Such signs can be found through your lab tests, physical examinations, and the symptoms you may experience, and are called signs of active disease. Some examples include anemia, thrombocytopenia, significantly swollen lymph nodes, liver or spleen, persistent fever, significant weight loss, and drenching night sweats. In most cases, in fact, 90% if not more, at the time of diagnosis, there are no signs of active disease. If you belong to this majority, the watch and wait approach is the current standard of care for you. Being on watch and wait means that you will not receive any treatment. Instead, you will be asked to have regular appointments with your physician and undertake certain medical examinations to timely detect if any sign that chronic lymphocytic leukemia is evolving appears. In such case, starting treatment might be indicated. Watch and wait may last for months or years. For some people, chronic lymphocytic leukemia evolves at such a slow pace that they may never begin treatment. People are often concerned when they learn that they will not begin treatment right away. It comes in contrast with what you may have heard for other types of cancer, for which people start treatment as soon as possible. It might seem so odd that you may doubt whether it is the right approach, but it is the right approach. In fact, medical research has documented that the watch and wait approach is currently the right option for people with chronic lymphocytic leukemia who have no signs of active disease. Not starting treatment to fight chronic lymphocytic leukemia straight after diagnosis might be quite an emotional challenge. You might feel uncertainty and worry about the future, as many troubling questions may arise. For instance, you may wonder when your physician will suggest you start treatment and in what ways it might affect you. These might make you feel that you have less control over your disease and your future. These questions and feelings are understandable and valid. However, attending regular appointments is indeed the best option to keep chronic lymphocytic leukemia under control in the long run. Dealing with the stresses and worrisome thoughts about chronic lymphocytic leukemia can feel like you are on a rocky road at times. Some things you could try during such times are sharing how you feel with close ones, getting more information from your healthcare team, joining peer support groups, and getting psychosocial support from local services. Trying to overcome the emotional challenges of living with chronic lymphocytic leukemia might open a door for you. Little by little, you may focus on what gives you pleasure and meaning in the present, and spend less time worrying about the future. As time goes by, you may start changing your priorities and spend your time based on what you actually cherish. This can give you a new and deep sense of purpose and meaning. For instance, you may start valuing more the simple joys of life and worrying less about everyday problems. That is why, despite its challenges, the watch and wait stage has been described by some people living with chronic lymphocytic leukemia as a chance for inner growth.